Welcome to Health for Life, your trusted source for health and wellness insights, proudly presented by Vitruvian Health, the comprehensive healthcare system serving Northwest Georgia and Southern Tennessee with leading entities like Hamilton Medical Center and Bradley Medical Center. We're dedicated to keeping our communities healthy and thriving.
Today we're talking with Dr. Arif Ali, board-certified radiation oncologist and medical director of Peeples Cancer Institute at Hamilton Medical Center. Dr. Ali, welcome to the show.
Yeah, thanks for having me.
Today we're going to talk about clinical trials and how they are now being conducted at Peeples Cancer Institute. PCI is setting itself apart by offering trials locally. What does this mean for our community?
Yeah, so this is a very important, milestone for the Peeples Cancer Institute. It's something we've been meaning to do for a while, and so we're excited to be able to finally be opening clinical trials. This is in collaboration with the Winship Cancer Institute of Emory University, and basically we're focusing on more advanced trials, widely available trials, which are called Phase 3 national trials for a variety of tumor sites. Breast cancer, prostate, some brain cancers, rectal cancer, even some gynecologic cancers, as well as head and neck cancers. This is important. When we first started thinking about doing it, we looked at the maps for several of these trials, and for many of these trials, there's wide availability. In urban areas like, Chicago, New York, in California. But in Georgia and even in the Southeast, there's not a lot of availability. We opened a lung cancer trial recently. For that particular trial, there's availability in Atlanta, certainly through Emory. But if you go north of Atlanta, we're pretty much it. This trial, that trial is not available in Chattanooga. It's not available to the east or west of us within the state or even across state borders. So it's definitely a need. And so we're excited to be able to fill that need, to be able to provide these advanced technologies, this forefront of cancer care available to patients, not only in this town or this region, but patients, even across state borders.
So just a moment ago, you mentioned that there are more trials on the way. Are there any specific types of cancers that are being targeted?
Well, the first one they opened is lung. The next trial that we're going to be open hopefully fairly soon will be breast cancer, but then after that it'll be prostate, brain, head and neck cancers, and rectal cancers. And
how do you decide which trials to actually offer?
We look at, so there's a lot of factors, we start with, what are the most common cancers in our area? So there's no point in opening. It is a lot of work and it's a lot of, it's a large expense on behalf of the Peeples Cancer Institute to be able to open these trials. We want it to make a difference. We don't want to just wastefully, spend these dollars, a lot of which were, or some of which were donated. We look at, what are the most common cancers in our area? And we start there. And then within those common cancers, we'll look at sort of a menu, if you will, of national clinical trials that are available, with Emory University, with Winship Cancer Institute. And within those menu of trials, we look to see, which of these are likely to have the biggest benefit? Which of these look to be the most successful? Which of these are going to make a difference? And then we'll have a group of those, and then we look and see, what is the availability of those trials elsewhere in this region? And usually there's not. For most of the trials I looked at, there is really not a lot of availability at all around here for Phase 3 national trials, in this region, the northern part of Georgia, or even the southern part of Tennessee, to include Chattanooga. And so we're looking for the biggest bang for your buck, so to speak, for the clinical trials. We don't have the resources to open hundreds of them, so the ones that we do open, we want to make a large difference.
And what is it that really sets Peeples Cancer Institute apart?
Peeples Cancer Institute is, on paper, it is, it's a great community facility, but I would argue that it really is rising above that, above that level. There are very few community cancer institutes that have the resources that Peeples Cancer Institute has. I like to say we're punching well above our weight class, so to speak. You're not going to find a lot of community institutes that have the technology that's available here, as well as the clinical trials. To have a partnership with a major national level university and academic cancer center like Winship Cancer Institute is a big deal. That's not something that is commonly found in this region. The other part about it is, People's Cancer Institute has had great support from the community and from donors, and that allows us to offer, all sorts of ancillary services that you would not likely otherwise find in a community center. I mean, things like, like we have massage therapy now. There's acupuncture available. We have physical therapy, occupational therapy right in the building. So all these sorts of ancillary services that are fantastic and important to have for supportive care is what we call them. Typically, you might only find those in a larger institute. But again, cancer center the size of People's Cancer Institute, it is unique and exciting to be able to offer these.
It's really exciting to hear all these great things, and I'm just wondering, what is the long-term vision for the Institute's role in cancer innovation?
So we always want to be at the forefront of technology. We always want to be at the forefront of cancer care. And usually, the looking at it globally, the institutions that are going to have, the most clinical trial availability, the latest technologies, those are usually academic institutions. So places like, Emory University or Winship Cancer Institute. And so we want to be able to offer as much of that technology as we can here at Hamilton. We don't want our patients to have to drive 90 minutes south for a treatment and then come 90 minutes north. I mean, besides the fact that many of them don't want to do that, many of them in our community literally can't. I mean, that is a huge deal for many of our patients to be able to battle the Atlanta traffic or even going up, up further north to say like Nashville. So we want to be able to, our goal is to be able to offer academic level care here in a community center such as People's Cancer Institute. And the way that we're doing that, the way that we're always trying to be at the forefront is clinical trials are an important component of that. First of all, clinical trials they're evaluating technology that are the forefront of medicine. And so our partnership with Winship Cancer Institute allows us to be able to provide those clinical trials, those technologies, and those different, drug regimens and chemotherapy regimens allows us to be able to provide those up here in the community. And then the other part about it is the technology. We're constantly upgrading machines. We're constantly looking at latest imaging equipment. Our goal is to be able to do that.
That wraps up today's episode of Health for Life. Thank you, Dr. Ali, for helping us learn more about the important cancer treatment that is provided through clinical trials at People's Cancer Institute at Hamilton Medical Center. Thank you for listening to Health for Life, a presentation of Vitruvian Health, formerly Hamilton Healthcare System.
This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem.